So let's return to reversing anticoagulation. So you have a patient who comes in who complains of GI bleeding at home, but he's not doing it here. But the unfortunate thing is that he's on Coumadin. And you check his INR and it's 5. So the worst thing that could happen to this guy is that he were to start vomiting blood again, in which case this anticoagulation is not going to help us. So the question now is, how do we turn off this Coumadin? So first got to remember how Coumadin works. It poisons the production of the vitamin K dependent factors. So that's 2, 7, 9, and 10, and of course protein S and C. So if only there was a way we could give those factors back to the patient. And luckily there is. There's a blood product we can give, and that is FFP, or fresh frozen plasma. So what's FFP? Well, when a kind volunteer donates a unit of their blood, this blood can be spun down into its component parts. So the first part here might be all the cellular components, like the red blood cells mostly, and then the top portion is the plasma, which has all the things that circulate, like coagulation factors, fibrinolytic factors, antithrombin 3 is in there, and various other things. If this is quickly frozen, then you get fresh frozen plasma, or FFP. So circulating in this plasma is 2, 5, 7, 9, 10, S and C. And so, obviously, this has the things that we need. So a couple of things we can notice first is that FFP is frozen. So when you order it, it has to be thawed. And so that's going to take about 20 minutes. Also, it's made from blood, and so you know that there's going to be all sorts of antibodies in there. So this thing needs to be type and crossed. Now, 1 unit of FFP is going to raise the factor activity by about 5%. And it also has a volume of 250 cc's. And you're usually going to be ordering about 4 units of FFP, and so that's going to be a liter. So that can be a lot of fluid in your elderly patients, so you might have to infuse that in slowly. Now, FFP is going to work pretty fast. I mean, think about it. You're just putting these coagulation factors back in the bloodstream, so technically it works immediately. So you can give your 4 units, and then you're going to want to check an INR again, with our goal of having the INR be less than 1.5, and if it's not, you might want to repeat the dose. And one more thing you might want to consider also is giving some vitamin K, so that the liver can start making these factors again. So let's review this portion real quick. So if you're on Coumadin and you're bleeding, but it's not life-threatening now, but it could be, and your INR is high, what you want to do is give 4 units of FFP, remembering that this is going to be about a liter. And we know that we're going to keep giving this, and it's going to work pretty quickly, and we're going to want to check our INR. Our goal is to have it under 1.5. If it's not, we're going to repeat the dose. At that same time, we're also going to give vitamin K. Vitamin K takes a little bit longer to work, but we want to replete these factors as well by our body making it in the liver. So let's talk for a minute about vitamin K then. So you remember those factors 2, 7, 9, and 10, S and C, require vitamin K as a cofactor in their production. And so by giving vitamin K, we allow the liver to make this. And it's going to take about a day to fully reverse everything. And really, it takes only 2 to 5 milligrams of vitamin K to fully reverse. However, people are variable, and so you just want to round up and give 10 milligrams so you get everybody. You're kind of hitting it with a shotgun, and so we're going to give 10 milligrams of vitamin K for life-threatening bleeds. For minor bleeds, you could get away with 1 milligram. Another thing worth remembering is that people can get anaphylactoid reactions from this vitamin K, so you do want to give it slowly. It's about a 1 in 3,000 chance of getting an anaphylactoid reaction, so give this over an hour. For these smaller ones, you can probably give that over half an hour. And once you give this, your warfarin is no longer working. You've turned it off, and it's going to be like that for a week. So maybe after you've taken care of whatever was bleeding and you want to anticoagulate them, then you're going to have to keep them on heparin for a week because the Coumadin is just not going to work. And let's talk about one last thing, and that's what is the significance of INR values? So what does it mean to have an INR of 1.5 versus 6 versus 10? Well, an INR of 1.5 means you got about 40% of factor activity. And if your INR is 2, that's maybe 30 to 35%. 3 drops down to 15%. 5 is 10%, and 6 might be down as low as 2%. So you can see that it's not really a linear relationship. So an INR of 10 versus an INR of 6, well, you know what? They're both pretty scary, and you're going to need to fix those. But it's not just this number that matters. Like you could give somebody factor 7, someone who is on Coumadin that is, and get their INR all the way down to 0.2, which looks great on paper, but they're going to bleed just as bad as that person who was poisoned with Coumadin who didn't get any. Because remember, there's so many other factors there. There's 2, 9, 10 that also need to be taken care of. So this number alone doesn't tell you the whole story. Okay, great. So that's it for this video. We talked about FFP and vitamin K and a little bit about INRs. Now, is there something that's better than FFP we can use? Maybe that works a little bit faster and lasts a little bit longer? Of course there is. And we'll talk about that in the next thing. That's going to be the PCC, prothrombin complex concentrates. Okay, bye.